The disorders covered in this unit are the obsessive-compulsive disorders and the feeding and eating disorders. Despite the similarity in names, obsessive-compulsive disorder is usually easily distinguished from obsessive-compulsive personality disorder by the presence of true obsessions and compulsions in the disorder. When criteria are met for both obsessive-compulsive personality disorder and obsessive-compulsive disorder, both diagnoses are recorded. The chapter begins with obsessive-compulsive disorder. It then covers body dysmorphic disorder and hoarding disorder, which are characterized by cognitive symptoms such as perceived defects or flaws in physical appearance or the perceived need to save possessions, respectively. The chapter then covers trichotillomania, that's a hair-pulling disorder, and excoriation, skin-picking disorder, which are characterized by recurrent body-focused repetitive behaviors. Finally, it covers substance medication-induced obsessive-compulsive and related disorders, obsessive-compulsive and related disorders due to another medical condition, and other specified obsessive-compulsive and related disorders, and unspecified obsessive-compulsive and related disorders. Obsessive-compulsive disorder is characterized by the presence of obsessions and/or compulsions. Obsessions are recurrent and persistent thoughts, urges, or images that are experienced as intrusive and unwanted, whereas compulsions are repetitive behaviors or mental acts that are individual feels driven to perform in response to an obsession or according to rules that must be applied rigidly. Some other obsessive-compulsive and related disorders are also characterized by preoccupations and by repetitive behaviors or mental acts in response to the preoccupations. Other obsessive-compulsive and related disorders are characterized primarily by recurrent body-focused repetitive behaviors, such as hair-pulling or skin-picking, and repeated attempts to decrease or stop the behaviors. Feeding and eating disorders are characterized by a persistent disturbance of eating or eating-related behaviors that results in the altered consumption or absorption of food, and that significantly impairs physical health or psychosocial functioning. Diagnostic criteria are provided for pica, rumination disorder, avoidant restrictive food intake disorder, anorexia nervosa, bulimia nervosa, and binge eating disorder. The diagnostic criteria for rumination disorder, avoidant restrictive food intake disorder, anorexia nervosa, bulimia nervosa, and binge eating disorder result in a classification scheme that is mutually exclusive, so that during a single episode, only one of these diagnoses can be assigned. The rationale for this approach is that, despite a number of common psychological and behavioral features, the disorders differ substantially in clinical course, outcome, and treatment needs. A diagnosis of pica, however, may be assigned in the presence of any other feeding and eating disorder. On the Level 1 cross-cutting symptom measure, items 16 and 17 make up the repetitive thoughts and behaviors domain. These items ask about unpleasant thoughts or urges or images that repeatedly enter your mind and feeling driven to perform certain behaviors or mental acts over and over again. There is a Level 2 measure, the Repetitive Thoughts and Behavior Scale, which is made up of 5 items, which are scored on a 5-point scale. The range of the total score is from 0 to 20. I encourage you to look over this measure, if only to get an idea of the kind of questions you want to ask about repetitive thoughts and behaviors. Both obsessive-compulsive disorder and hoarding disorder from DSM-5 are coded as F42, obsessive-compulsive disorder, in ICD-10. F42 has 3 different specifiers in ICD-10. F42.0 is predominantly obsessional thoughts or ruminations. F42.1 is predominantly compulsive acts, and F42.2 is mixed obsessional thoughts and acts, a differentiation which is not available in DSM-5. Body dysmorphic disorder is coded in the somatoforms disorder section of ICD-10 as a subtype of hypochondriacal disorder. Trichotillomania, hair pulling disorder, is in the habit and impulse disorders section of ICD-10. DSM-5 lists the ICD-10 code as 63.2, but it is actually 63.3. Excoriation, that is skin picking disorder, is in the L section, which is for diseases of the skin and subcutaneous tissues. Remember that any time you see an 8 in the tens column of an ICD-10 diagnosis, as in L98.1, it means that the diagnosis is in the not elsewhere classified category. Excoriation disorder is in the other disorders of the skin and subcutaneous tissue not elsewhere classified in the ICD-10. The ICD-10 codes for pica, the eating of one or more non-nutritive substances on a persistent basis, is F50.8 in adults and F98.3 in children. Notice that F98 is the other behavioral and emotional disorders with onset usually occurring in childhood or adolescence section of ICD-10. Rumination disorder, repeated regurgitation of food, is also in this section of ICD-10 as a feeding disorder of infancy and childhood. I'm not sure what ICD-10 diagnosis is appropriate for an adult who regurgitates food for over a month. Avoidant restrictive food intake disorder is classified in the other eating disorders category of ICD-10. In ICD-10, anorexia nervosa has two subtypes. F50.01 is a restricting type, and F50.02 is a binging-purging type. Bulimia nervosa and binge eating disorder have the same DSM-5 diagnostic code, but different codes in ICD-10, with binge eating classified as other eating disorder.